One would think that in a world as technologically advanced as ours, society would have a firm grasp on effective mental health treatment. However, as much as physicians and large regulatory organizations such as the FDA would like this to be true, it is simply not the case. The National Survey on Drug Use and Health estimates that there are around 17 million people affected by recurrent depressive episodes in the United States, and upwards of 300 million worldwide. The most common forms of treatment for major depressive disorder, or MDD, are either psychotherapy or pharmacotherapy. Psychotherapy is the treatment of mental conditions through verbal communication and interaction, while pharmacotherapy is the use of medication. Studies show that over 50% of newly diagnosed patients are treated with medication by itself. Only a small percentage are given talk therapy or a combination of the two. Meta-analysis of the topic details why other forms of treatment are more effective, efficient, and provide the greatest assurance of general quality of life in the patient. Not only is talk therapy more effective, it is significantly less invasive to the human body. Antidepressant medication works by changing the chemistry in your brain. Rather than truly addressing the issues affecting an individual's mental well-being, the drugs crudely block the brain's ability to feel those emotions. Because of this, it is very common for a patient's depressive state to return after they stop taking the medication. The negative short and long-term side effects include, but are not limited to, gastrointestinal issues, sex drive-related issues, sleep disturbances, increased risk of cardiovascular disease, increased risk of dementia, and in many occasions, an increase in aggressive and suicidal behaviors. These side effects are negligently underreported in the clinical trial stage of the drug's development and are made difficult to obtain by the clinical facilities themselves. This is a morally bankrupt issue that is widespread throughout the world of psychiatry. Studies show that long-term psychotherapy is significantly more effective and efficient at treating MDD when compared to pharmacotherapy. The Mentrum Institute for Mental Health found that talk therapy and combination therapy had an increase of 20% in success rate when compared to pharmacotherapy. The existing methods used to treat most depressed patients are highly problematic. This is due to primary healthcare physicians prescribing medication without having a complete understanding of their effects, knowingly or unknowingly, as well as patients being more willing to choose medication over talk therapy due to insufficient education on the topic and misinformation propagated by healthcare professionals. There is also a dramatic lack of therapist and counselor referrals in comparison to the number of prescriptions handed out by the healthcare providers. A population of people who are reliant on harmful drugs that they do not comprehend is a system that is destined to experience a vast number of negative outcomes. It is absolutely essential that patients who are looking for aid in treating their depressive episodes request comprehensive information about the potential short and long-term effects of their medications in comparison to the benefits offered through psychotherapy. On top of this, healthcare providers must exhaust every other option of treatment before recommending neurological chemical intervention.